So despite using a lot of antidepressants within primary care, we're often left with patients who may not be as adherent with the medication as we'd like, may take it intermittently or stop it entirely. How do we get around that? Easier said than done, but a lot of it comes down to education when you're starting to prescribe the medication, the antidepressant. You want to make sure that the patient understands the rationale for the prescribing, along with the risks and benefits of that prescribing for them, of that particular medication. So with some knowledge about potential adverse effects, side effects, you can kind of prepare the patient for maybe the surprised side effect that if they weren't aware that it was expected may lead to them stopping the medication. So forewarning them can be really helpful. You also want to educate them very clearly about what the anticipated course of the treatment for depression is going to be. We live in an era where patients expect a quick fix. That's not necessarily the case with antidepressant medication. It can take a couple of weeks, 4 weeks often, for some of the more typical antidepressants to really reach efficacy. So you have to tell them it's going to be a while until they may feel better. Often others will notice the patient feeling better before, or acting better before the patient themselves. You also want to, at the same time, kind of say that it may take 4 weeks for you to feel better, but those side effects we talked about, those are going to happen sooner. So you really have to make it through the side effects, which will get better over time, hopefully, and then we're going to see the benefit. And then educate them that even when you start feeling better, this is a medication that you need to continue taking for about 6 to 9 more months to kind of address that episode of depression. So it comes down to education, education, and education.